This is a story of Amaka, a story of Funke, and a story of Aminat, who came down with a complication of fibroid, which we also know as myoma. It all started with complaints of heavy and prolonged menstrual bleeding, severe abdominal pain, a persistent feeling of pressure in the lower abdominal region, and they went ahead to consult a doctor. And after consultations, they were asked to do some diagnostic tests, which include scans. The result came back after the doctor gave them different treatment options. Amaka and Chioma, including Funke and Aminat, told the doctor that they'll be coming back in a few weeks' time so that treatment can start as soon as possible. But do you know what Amaka, Funke, and Aminat did? Instead of following the professional advice they received, they turned to their friend for solutions. Of course, their friend gave them solutions against medical and professional advice. Some recommended inserting some mixtures into their body to bring out the myoma. My people, days turn into weeks, weeks turn into months, and Amaka, Funke, Aminat's case worsened. The concussion they give them did not work. Instead, it caused severe infections and complications. Their marriage was at stake, their health was at stake. Why did I say their marriage was at stake? Because Amaka, Chioma, Aminat, Funke came down with another diagnosis of acquired dysmenorrhea. That is a medical term. Don't worry. I will break it down. Okay? Acquired dysmenorrhea means when the walls of the vagina is narrowed like this. You know, there's a space in between the vaginal walls, right? But for their cases, it is what? Like this. It became narrowed due to the concussion they used. The only option she has right now is to have a reconstructive surgery of the vagina, which is also known as vaginoplasty, because the husband is at home threatening them. Oh no, we can't continue like this. Vagina is narrowed now, no more sex. A vagina that was not narrowed, it was, at least it was opened. There was a pathway. This is someone with 2, 3 kids, 4 kids. Now tell me, now vagina is narrowed. And you know our men now, they have to do the do. So these people need to save their marriage and also save their life. This is a costly and painful ordeal she could have avoided seeking and adhering to professional care. Now, this is the story of a lot of ladies out there. Hello fams, welcome back to my YouTube channel. My name is Ade, and on this channel we talk about health tips, finance tips, self-development, and I think I'll also include freelancing and remote tips. So basically in this video I'll be talking about fibroid. Let's talk about it. I have a body. This means that it is a serious issue and we need to treat it now, because the incident rate of fibroids is high and even its complication. So let us talk about it. Amaka Funke Amina's story is an important reminder to always seek professional health care and also stick to medical advice and treatment. In this video, we'll dive deep into fibroids. What are they? Type, the causes, treatments, and potential complications. So stick to the end of this video because I believe that this video might save a life and maybe yours. Now, what is fibroid? Fibroids are also known as uterine myomas. They are non-cancerous growths that develop in or on the uterus. Uterus is also what we know as womb. Those fibroids vary in size, very small. I have seen fibroid as big as a baby, even more than a baby. I've weighed a fibroid of about 4.5 kg, big. And you can see some that are small, tiny, like an orange seed. A lot of ladies are out there, they have no signs, no symptoms of fibroid, but they actually have it. Whereas others like Amaka, like Funke, like Aminat may face severe issues. I hope with that we are able to understand what is fibroids. Okay, now let me show us what the uterus, that is the womb, looks like. Come, let me show you. Now, it's a dome shape. I hope you can see what I'm doing. It's like this. The uterus is something like this, right? Now, it has like a opening here, okay? Then there is a cervix over here, okay? It's another opening. Then to the vagina, all right? So this is the visual representation of uterus, that is a womb. We're not going to talk about this part, right? We are more concerned about this part. Now, this is what we call the uterus, also known as womb. All right, good. So you see this uterus, it actually comes in 3 layers. All right, we have, let's just assume, let me draw another layer. Okay, let me draw another layer again. Now, this is the outer layer. It has a medical term, but I don't want to bore you with that. It has an outer layer, okay? Now, it has a middle layer, okay? This is the middle layer, all right? Middle layer, and also an inner layer, okay? Also an inner layer. Now you see these fibroids, like I said, they come in different sizes, and you can actually see them in any of these layers. Sometimes when you open up a woman, you will see those fibroids on this outer part like this. You see them in different sizes. Some are very small. I hope you can see that. Some are very small, and some you will see them in the inner layer. This inner layer like this, but you have to dissect this inner layer, sorry, the middle layer, to see them. And some inside the womb itself. Once you open the uterus, you will see them in it. Now, as a lady, you don't know the type of fibroid you have. You don't know, maybe difibrosis is inside your womb. You don't know if it is in the middle layer. You don't know if it is outside the layer. And you now went against the medical advice to listen to your friend. Now insert something through here, because at least if you insert some stuff in through here, it will go to your vagina, right? To your cervix, and then it will go into your womb. Now let's assume the fibroid is actually outside this place. That means whatever you insert, we have to work in the inner layer, middle layer, into the outer layer. And all these things can lead to complications. All right. So this is just how it works. Like, this is how the womb looks like, and this is the layers, and also where you can find all those fibroids. I hope you are clear. All right. Like I said, that we have different types of fibroid. We have the intramural fibroid, which grows inside the muscular layer of the womb. We also have the subserosal fibroid. This one actually grows on the outer layer of the womb. Okay. We have another one, submucosal fibroid. This grows in the inner layer, and this actually causes bleeding. And we also have pendiculated fibroid. This one is actually attached to the uterus to the womb by a stalk. And you see, each type of those fibroid that I've listed has its unique set of signs and symptoms, including potential complications, which is why proper diagnosis and treatment is key. Now, let's talk about the causes of fibroids. As we all know, the causes of fibroid is unknown. But according to the research I did personally, though my research is not published, it's something I did and analyzed myself. And I realized that the major cause is due to lifestyle. If we look in the 80s, 90s, even early 20s, like 2000, 2001, incidence of fibroids is not much compared to this age. In my facilities, we do have at least 2 cases of myomectomy. Myomectomy is a surgical intervention for to remove, the myomas and the fibroids. That is just the least. Sometimes we could have up to 5 cases of myomectomy in a week. Other causes of fibroid is hormonal changes, especially estrogen and progesterone. Like, I don't understand why a lady that is not married, you're not married, you don't have any kids, and you are going for family planning. I don't understand, ladies. We need to wise up. We need to be intentional about your health. Like, you see, when it comes to all those things, we ladies, we are at the receiving end. You never born and you are opting in for family planning because you are having sex with your boyfriend and you don't want to get pregnant. But now, that's what they do. That's what they do. Stop it. This is another year. Well, another cause of fibroid is family history. We have some people that, myomas and other stuffs are in their gene. There's always a tendency for them to have it. That is another cause of myoma. Another cause is age, particularly if you are above 30. But guess what? Ladies below 30 are now coming down with fibroid. Let's talk about the treatment options. The good news here is that fibroid is not a death sentence. It is not a death sentence. Because you have fibroid doesn't mean you are going to die. Because you have fibroid means you will not have a child. No, it is not like that. It is treatable. That is why I'm here to encourage you that you go to a professional care. You need to consult with an obstetric and a gynecologist. They will give you the best treatment options that are available. Stop seeking non-medical advice because you have fibroid. Okay, go for a professional care. We have treatment options that are available, such as medications, hormonal therapy that will shrink the fibroid. Okay, we also have some non-invasive procedure such as laparoscopy. We also have hysterectomy. This is for severe cases, all right, and especially for those that have their complete family size. But you see, all those options, you need to consult an ORG doctor, which are going to give you the best medical advice and medical treatments that will work for you. Your treatment, like I said, should be guided by a medical professional based on your symptoms, based on the size, based on the type, based on the location of the fibroid and your future plans of having children. All right. I hope I'm able to clarify that. Let's talk about the complications of fibroid. If fibroid is left untreated, it can lead to severe bleeding, in which such people can actually come down with severe anemia. Another complication has to do with pregnancy complications, and the last complications in rare cases has to do with infection, and also the story of Amaka Funke and also Aminat I just told you about. Now, quickly, let's go to the misconceptions about fibroid. And the first misconception is that fibroids always cause symptoms. There are a lot of women outside there with fibroids and no signs of symptoms at all. Okay, like I said earlier on, fibroids vary in size, type, location, and while some cause significant symptoms, other remains undetectable unless discovered during routine examination. Okay, and the second misconception is that fibroids always require surgery. No, no, no. not all fibroids require surgery. You should know that fibroids can be managed medically and not always surgically. The next misconception is that fibroids always lead to cancer. Fibroids are almost always benign, that is non-cancerous. There is no evidence to suggest that benign fibroid can actually transform into cancer. So the next misconception is that birth control causes fibroids. Like I mentioned earlier, that we have some single ladies that have not given birth before going for family planning. I'm not saying that family planning actually causes fibroid. What I'm trying to say is that the hormones such as estrogen, progesterone that are usually found inside birth controls can actually make existing fibroids to grow. I hope you understand what I'm trying to say. There is no direct link between birth control, family planning, and the development of fibroid. But like I said, hormones such as estrogen, progesterone, which are present in some contraceptives, can influence the growth of existing fibroids. Now, the next misconception about fibroid is it can only affect older women. No. I understand that fibroids are common between the age of 30 to 50 years, but it can also affect younger women due to genetics, family history, lifestyle factors, or hormonal changes, because all these can actually influence the development of fibroid, making them possible at any reproductive age. Another misconception is that diet alone can cure fibroid. No. While a healthy diet can actually help to manage symptoms and prevent fibroid growth by balancing hormone and reducing, however, diet alone cannot shrink fibroid or cure them. So moving on to the next one is that pregnancy cures fibroids. Pregnancy may temporarily slow fibroid growth, but it cannot cure it. We only slow the growth due to hormonal changes. When one is pregnant, a lot of hormonal changes do occur, and all this can actually slow the growth of fibroid, but it will not eliminate it. Another misconception is that concussions, natural stuff can cure fibroids. Like the story I just highlighted, many unverified remedies such as concussions are promoted as fibroids cure. But I want to tell you today that this can be harmful and cause severe complications, just like Amaka Funke Aminat's case. Another misconception is that fibroids always lead to infertility. Why fibroids can sometimes affect fertility? I've seen women with fibroids getting pregnant, conceive, and have healthy pregnancy. The impact of fibroids actually depends on the size, on the location of the fibroids. The next misconception I'll be talking about is that fibroids will disappear at menopause. Fibroids may shrink after menopause to lower estrogen levels, but they don't always disappear. Some postmenopausal women continue to experience signs and symptoms of fibroids, which may require treatment. So I share this misconception about fibroids because misconceptions about fibroids can lead to unnecessary fear or poor health decisions. So educating yourself with accurate information is essential. Don't forget to always consult a licensed healthcare professional for personalized advice and treatment options. Okay? Amaka Funke Aminat's story actually highlights the dangers of ignoring professional medical advice. I need to let you know that fibroids are manageable. It's not a death sentence, okay? But only if you act wisely. Let me tell you something. Your health is worth more than unverified remedies or shortcuts. Thank you for watching. Thank you for sticking right to the end of this video. If you found this video helpful, don't forget to like, share to your female friend, colleague, wife, girlfriend, daughter, and also subscribe to my YouTube channel for more helpful content. Remember, your health is your wealth. Thank you. Bye.